Thanks for staying with us. Veterinarian David Graff here today to take your questions. First, introduce us to a cat who kind of blends in with your jacket.
Yes, he does. His name's Destin, and he's from the Cedar Rapids Animal Care and Control. And he's a young, he's probably about 2, neutered male. He's very friendly. He
Pretty cat, purring,
purrs very well.
Blue eyes.
Yep.
Wonderful cat. If you're interested, give them a phone call. There, of course, is this time of year when we start thinking about flea and tick, if you do it seasonally.
Yes.
And there's a new product out there you want to
there
talk
is.
about.
For those of you who have used the product Frontline, Frontline is a topical that's applied once a month and it kills fleas and ticks. Well, the same people that make Frontline have introduced a new product that's an oral product called NexGard. And it comes in a meaty, very flavorful, chewable tablet. And it's for dogs only. And it works to prevent both fleas and ticks. So it's an effective oral once a month.
And this is something that you would recommend, because I'm the traditionalist topical. I've always done it that way and just think that that's what's always worked.
Well, if that's working for you and you don't mind the mess, then stick with it. If you would prefer something less messy,
the dog may prefer.
The dog may prefer.
The tasty chew.
Now the oral is not available for cats. It's for dogs only.
Dogs only. Something to keep in mind. Cynthia is on the line with a question today. Go ahead, Cynthia.
Yeah, I was wondering, I have 2 dogs, and my oldest one he will be 11 in August, and he was confirmed with fatty lumps. And I was wondering if once he gets them, is there any way of stopping it, or does he continue to get it?
Well, fatty lumps, also called lipomas, are usually benign accumulations of fat. They start from one single fat cell that gets out of order and produces too much fat. That's why they're round, because it's got a single cell nucleus. They're mostly a cosmetic problem. Very few of them are malignant. Occasionally there will be malignant ones that are invasive. They're usually locally invasive. Most lipomas don't need to be removed. They can be monitored for growth. If they are in a location that causes problems, for instance, I had a dog come in the other day that had a football-sized lipoma underneath the armpit. And this could cause a problem with mobility. So if they're in a bad place or if they're growing real fast, then they definitely should be considered for removal.
Check with your vet.
But there's no relationship between lipomas at different places on the body. And dogs that get them tend to get more of them. And this kitty's really shedding.
Well, thanks so much for joining us today. We appreciate it. And coming up tomorrow, a financial expert will be here, and one more check your forecast when we come back.